I feel like I'm probably messing with this.
Whenever you're ready.
Okay. Attention! If you or a loved one has been diagnosed with mycetoma, you could be entitled for compensation.
Mycetoma is a chronic and progressively destructive inflammatory disease, usually of the foot, but can occur on any part of the body.
Mycetoma was first reported in the mid-19th century in the Indian town of Madura and was initially known as Madura foot.
It can be acquired by traumatic inoculation of 20 or more species of fungi or bacteria into the subcutaneous layer of the skin and is usually found in the lower extremities. It enters the body through sites of local trauma. The vehicle for transmission of mycetoma is contaminated soil, and it may also be airborne.
Those at risk are individuals of low socioeconomic status and manual workers such as agriculturalists, laborers, and herdsmen. Those also commonly infected are young adults, particularly males between the ages of 20 and 40 years in most developing countries.
Mycetoma causes a granulo... How do I restart? I cannot pronounce that word.
I think it's granulomatous. You can just put, it causes a...
Because I cannot pronounce that word. Mycetoma causes, can I just say causes a inflammatory response?
Yes.
Okay, cool. And then we don't move for a few seconds and we go again, right?
Yeah, let's do that.
Okay. Mycetoma causes an inflammatory response in the deep dermis and subcutaneous tissue which can extend to underlying bone. Formation of grains containing aggregates of the causative organism may be discharged onto the skin surface through the sinuses. Mycetoma commonly affects foot or lower leg, sometimes hand, but can occur anywhere on the body. Usually there are painless lesions. However, a secondary infection and bone expansion can cause pain and itching. In advanced cases, deformites may be caused, such as ankylosis, which cause stiffness and immobility of the joints due to bone fusion.
When diagnosing mycetoma, the organism can be detected by examining surgical tissue that is
Biopsied.
And
And then you don't
my
say
brain
anything,
looked at
and
that
then
word,
you restart.
and it was like, okay. When diagnosing mycetoma, the organism can be detected by examining surgical tissue that is biopsied and lesion sinus discharge. DNA sequencing and imaging techniques are also used. There are no common treatment techniques for mycetoma in epidemic villages.
Treatment depends on the causative organism of the bacterium. A mixture of long-term antibiotics with antifungal drugs is used for the fungal type. Treatment is usually unsatisfactory, has many side effects, is very expensive, and is not easily accessible to endemic areas.
Mycetoma is not a notifiable disease, so it's not a disease required by law to be reported. There is no surveillance systems for this disease, no preventable... There we go again. We're just going to start the whole thing over. Mycetoma is not a notifiable disease, so it's not a disease required by law to be reported. No surveillance systems for this disease exist, and no preventable or control programs are available. Preventing infection is difficult. People living and traveling to endemic areas are advised to not walk barefooted. Being a badly neglected disease results in a lack of accurate data on incidence and prevalence.
So call the number below for a free consultation to see if you or your loved ones are entitled for compensation. That's 1-800-MYCETOMA. I repeat, 1-800-MYCETOMA. That's it.
Yeah.
Thank you.